Hello. Today we will be discussing the human immunodeficiency virus, also known as HIV. HIV is an enveloped retrovirus that contains two copies of a single-stranded RNA genome. The virus's surface fuses with the cellular membrane, which allows entry into a T helper lymphocyte. After integration in the host genome, the HIV provirus forms and then follows transcription and viral mRNA production. HIV structural proteins are made and assembled in the host cell. Viral budding from host cells can then release millions of HIV particles that can go to infect other cells. The HIV life cycle. HIV has a 7-stage life cycle that includes binding, fusion, reverse transcription, integration, replication, assembly, and budding. Stage 1 is binding. This is where HIV attaches itself to receptors on the surface of a CD4 cell. Stage 2 is fusion. This is where the HIV envelope and the CD4 cell membrane join together, which allows HIV to enter the CD4 cell. Stage 3 is reverse transcription. This is where HIV releases and uses reverse transcriptase inside the CD4 cell to convert its genetic material into HIV DNA. This allows HIV to enter the CD4 cell nucleus and combine with the cell's genetic material. Stage 4 is integration. This is where HIV releases integrase inside the CD4 cell nucleus. HIV uses integrase to insert its viral DNA into the DNA of the CD4 cell. Stage 5 is replication. This is where HIV begins to use the machinery of CD4 cell to make long chains of HIV proteins, which are building blocks for more HIV. Stage 6 is assembly. This is where new HIV proteins and HIV RNA move to the surface of the cell and assemble into immature HIV. Stage 7, the final stage, is budding. This is where newly formed immature HIV pushes itself out of the host CD4 cell. The new HIV releases protease, which breaks up the long protein chains in the immature virus, thus creating the mature virus. Expected outcomes and prognosis. HIV infection can be classified into 3 different stages: Stage 1, Stage 2, and Stage 3. Stage 1 is characterized as the acute stage. The patient is asymptomatic or has persistent generalized lymphadenopathy, which is swollen lymph nodes. There is a lack of AIDS-defining condition and either a CD4 plus T lymphocyte count higher than 500 or a percentage of total lymphocytes of more than 29%. This stage possesses the greatest risk of transition. Stage 2 is characterized as the chronic or latent stage. The virus is present, but the patient may not be experiencing symptoms. There is a lack of AIDS-defining condition and either CD4 plus T lymphocyte count between 200 and 499 or a percentage of total lymphocytes between 14% and 28%. Patient may experience moderate unexplained weight loss, recurrent respiratory infections, herpes zoster outbreak, recurrent oral ulcerations, popular pruritic eruptions, seborrheic dermatitis, and fungal nail infections. Stage 3 is characterized as AIDS. The patient's CD4 plus T lymphocyte count is lower than 200 or a percentage of total lymphocytes less than 14%. The patient may experience severe weight loss, chronic diarrhea, persistent fever, persistent oral candidiasis, oral hairy leukoplakia, pulmonary tuberculosis, severe presumed bacterial infections, acute necrotizing ulcerative stomatitis, gingivitis or periodontitis, anemia, neutropenia, and chronic thrombocytopenia. People with HIV who are diagnosed early and get and stay on antiretroviral therapy can keep the virus suppressed and live long, healthy lives. The prognosis of a patient with HIV and CD4 count greater than 500 results in a life expectancy the same as someone without a diagnosis of HIV. A patient with untreated AIDS has a life expectancy of about 1 to 2 years after the first occurrence of opportunistic infection. Causes and risk factors. So, some of the risk factors associated with HIV or AIDS include unprotected sexual intercourse, IV drug use, which includes sharing needles or drug injection use equipment with others, hemophilia, blood transfusions, healthcare occupation, so working as a healthcare professional, living in poverty, pregnancy, because infants can acquire HIV by vertical transmission from their mothers, either transplacentally or during delivery. Breastfeeding, because transmission can occur through breastfeeding, and older age, because HIV infection can go undiagnosed in older adult clients due to the similarity of its manifestation to other illnesses that are common in this age group. Prevention. Some of the important topics of prevention include education. As far as education goes, we want to educate on the importance of practicing safe sex, the ramifications of high-risk sexual behaviors, the ramifications of injecting drugs and sharing needles, syringes, or other drug paraphernalia, STD screenings, because STDs can have long-term health consequences and they can increase your chance of transmitting HIV or getting HIV. Use of autologous transfusion, which is using the blood patients themselves donate before an anticipated surgery. Seeking blood donations from family members. Patients who are HIV positive should refrain from donating blood, organs, sperm, sharing needles, or other drug paraphernalia, not sharing razors, or getting tattoos. Patients should inform medical personnel providing direct care of their HIV diagnosis. If you test HIV negative, you should consider pre-exposure prophylaxis. That medication is highly effective in preventing HIV, especially if you are engaging in sexual activity with somebody that is HIV positive. If you test HIV negative but recently have been possibly exposed, then consider post-exposure prophylaxis. If you're sexually active with your HIV partner, with a partner that is HIV positive, use protection to ease your mind. You can participate in counseling. There are tons of community available resources as far as getting your HIV diagnosis, living with HIV, emotional support, things like that. Behavior modification. So you should be using protection correctly every time you engage in sexual activity. You should choose less risky sexual behaviors. So oral sex is much less risky than anal or vaginal sex. Sexual activities that don't involve contact with bodily fluids, including semen, vaginal fluid, or blood, carry no risk of HIV transmission. If you are HIV positive, adhere to your medication regimen. If you stop taking your medication as prescribed and keeping an undetectable viral load, you have effectively no risk of transmitting HIV through sexual intercourse. Do not engage in recreational IV drug use or share needles, syringes, or other drug paraphernalia with others, as we previously discussed. So some of the signs and symptoms that you commonly see with people who are newly diagnosed with HIV include swollen lymph nodes, night sweats, mouth ulcers, fever, rash, muscle aches, chills, fatigue. Patients often describe this initial manifestation of HIV infection to common viral illnesses such as the flu, upper respiratory infections, or stomach viruses. And a lot of these patients are going to develop these manifestations within days to weeks after contracting the virus. And some patients may not experience symptoms at all. All right, labs and diagnostic testing. So there are quite a few labs and diagnostic tests that you can undergo to reach a diagnosis of HIV positive or HIV negative. One of them is called the enzyme-linked immunosorbent assay. It's called, also commonly known as the ELISA. Test for HIV antibodies. This test tests for HIV antibodies but does not detect the virus itself. A patient can be negative for their ELISA test early in the course of infection because detectable antibodies have not developed. Then we've got the Western blot antibody testing. This one's more reliable than the ELISA, but more time-consuming and more expensive. When you combine this one with the ELISA, a specificity of greater than 99% is achieved. In this test, the patient's serum is mixed with HIV proteins to reveal a reaction. If antibodies are present, a detectable antigen-antibody response will occur. Then we've got HIV viral load tests. This test measures the amount of actively replicating HIV Levels correlate with disease progression and with response to antiretroviral medications. Levels higher than 5,000 to 10,000 indicate the need for treatment. Then we've got a CBC, which is a complete blood count. This test is performed to detect anemia, leukopenia, and thrombocytopenia, which are often present with HIV infection. Then we've got CD4 count. This is most widely used to monitor the progress of the disease and to guide medication therapy. Then we've got platelet count. There is an expected decreased range with platelet count whenever you are HIV positive, and that's usually going to be less than 150,000. Treatment. So the first treatment we have on here is medication therapy. Then we've got eating healthy foods such as fresh fruit, vegetables, whole grains, and lean protein. Make sure that you are receiving proper vaccines, and make sure that those vaccines you are receiving are inactivated to prevent infections such as pneumonia, the flu, HPV, hepatitis A, and hepatitis B. We've got alternative medicine, and then we've got some mind-body practices on here such as yoga, meditation, and massage. So we've got quite a few medications to go through as far as medication therapy. The most common one is antiretroviral therapy. We've got nucleoside analog reverse transcriptase inhibitors, also known as NRTIs or NARTIs. These prevent RNA from being copied into DNA. Then we've got non-nucleoside reverse transcriptase inhibitors, also known as NNRTIs. These are used in combination with NRTIs and PIs. Then we've got PIs, which are protease inhibitors. These block the function of protease and result in the production of immature, non-infectious particles. When these class of drugs are combined with other antiviral drugs, these chemicals increase the chance on eliminating the virus by interfering with the different stages of its life. Then we've got entry inhibitors, also known as EIs. These prevent HIV from entering target cells. Then we've got integrase inhibitors. These inhibit viral replication by stopping the HIV enzyme integrase from inserting into the host cell DNA. Then we've got anti-neoplastic medication. This is an immunostimulant that enhances the immune response and reduces the production of cancer cells. This is used very commonly with Kaposi sarcoma cancer. Then we've got agents used in combination with antiretroviral therapy, including interferons, interferon alpha, and gamma interferon. We've got some alternative medicine, including acetyl L-carnitine, which is used to treat HIV-related nerve pain. We've got whey protein and certain amino acids, which are used to help with weight gain. We've got probiotics, which is used to treat HIV-related diarrhea. We've got vitamins and minerals used to treat low levels of zinc, iron, and selenium. And this includes vitamin A, vitamin D, vitamin E, vitamin C, and vitamin B. And then we've also got shark cartilage on here. So there are quite a few complications with HIV and AIDS as well. The first one being opportunistic infections. Some of these opportunistic infections include cytomegalovirus, candidiasis, which is yeast infection. We've got cryptococcal meningitis, cryptosporidiosis, toxoplasmosis, tuberculosis, and pneumonia. Then we've got cancer on here, which includes Kaposi sarcoma and lymphoma. We've got kidney disease, liver disease, HIV-associated neurocognitive disorders, also known as HAND. We've got wasting syndrome, fluid electrolyte imbalance, HIV encephalopathy, and then we've got the progression to acquired immunodeficiency syndrome, also known as AIDS. Lastly, we have nursing diagnosis. The first one being ineffective coping. We've got risk for infection, anxiety, fear, and deficient knowledge. I think these all play pretty well into HIV because as somebody that is newly diagnosed, you might not understand how to properly cope. As you get further along in your disease of HIV, you're going to be at risk for infection because, you do have a suppressed immune system. Anxiety and fear. Being that you're newly diagnosed with HIV, you might be fearful of what your life is going to look like, be anxious that, you know, people might not want to engage in sexual activity with you anymore if you disclose your status. Fear if you're a woman that, you know, one day whenever you get pregnant, you won't be able to breastfeed, or your baby could possibly get HIV from you. And then deficient knowledge, you know, as somebody who is newly diagnosed with HIV, you might not know much about the disease. You know, you might not know how you got it, how it's transmitted from person to person, what kind of medication you're going to have to take, how long you're going to have to take that medication. So these are just a couple nursing diagnoses that I thought fit well with a diagnosis of HIV. And that is it for today. Thank you so much and have a great day.